ability for ketamine to just change the way that I felt like I was thinking about myself. I just need to spend 30 or 40 years just meditating in a corner to be able to experience some of the insights.
Welcome to another episode exploring evolution. I'm your host, Amandha Zhane, and it's time to remember your powers. Some of you may know this as a party drug, but it is an important healing modality that is now sweeping the globe and healing many along the way. I'm talking about ketamine, and I've had a beautiful personal journey with it myself, and it's all due to these two beautiful humans who are sitting with me today. William Beesley, who holds a Master's of Science, and Rita Rutland, a nurse practitioner, who together run Restorative Health Primary Care in Sandy, who offer ketamine infusions and injections for people seeking that next level of healing. Welcome, you guys. Thanks so much for joining me. How are you?
Wonderful. It's good to be with you again, Amanda.
Good to be with you too. I've been so honored to be in your space and observe how you guys are serving the community and the type of healing that happens within your beautiful space regarding the ketamine. I've been lucky enough to be a ketamine guide with you guys for a few months and witnessed many people releasing trauma, coming to new epiphanies about their life, and expanding the version of themselves. Like I can't even put into words how amazing I feel this medicine is. I wanted to go into some of the science real quick. Ketamine was FDA approved. I think it was in the 70s. Am I getting that right?
I think 1958, but I'm sorry, 59, but really started getting used about 3 years later, 1961, 62-ish time frame, and was primarily used actually in the battlefields of Vietnam as a quick, safe anesthesia to use in a field setting to get people quickly out of pain and treated. And then it kind of expanded from there.
Yeah, it seems like a quick, how do you say this? It's not a fix-all solution to everything. I'm not saying that, but it is a very quick intervention for people who are in crisis, I've noticed, and who are struggling with treatment-resistant depression, chronic pain, migraines, all sorts of different things. I'm curious how it affects our brain, because when I have experienced ketamine infusions myself, it really feels like the medicine is doing a lot of the inner work for me, coming from a spiritual background where, you do meditation, you do a lot of inner work. It feels like that medicine is going in and doing something powerful. Do you know any of the science behind what I might be experiencing spiritually?
So what they've found as far as how it works for mood side of things and kind of like what you're feeling as far as your brain being rewired or stimulated to connect is that it helps to regrow neural connecting sites as well as make new ones. Dendrites, so your nerves have these little fingers that reach out. Dendrites are the endings, these are the beginnings, and they connect at these locations, right? And so what ketamine does is help to regrow some of these shriveled connections because they haven't been accessed, haven't been used. And it grows back like bolder, more like stronger connections, as well as budding to make new connections. And so those new connections are what allows you to basically shift your relationship with whatever isn't working for you, create new processes, new connections, new habits, new thought processes that take your life in a direction that you're wanting to go. So it kind of helps to re-access the core of you and who you are, help you remember all the things that you kind of forgotten that you get enjoyment out of, as well as reset things. And so that resetting is really what allows you to renegotiate your relationship with whatever isn't working for you and really set out for a new pattern to be created.
That is so well said, Rita. I apologize for the plane, but it is really powerful how you described the overall effect on your life, because when you have a new perspective and you remember some of those parts of yourself or some of those old dreams or whatever, renegotiate relationships with things, I really feel like you come out of these treatments with a greater sense of hope. Do you feel that's accurate?
That is probably one of the main things that get reported, especially after that first treatment, because ketamine binds to a lot of neural connecting sites. And so it really stimulates the entire brain. And so it gives you kind of this like reboot reset aspect from that initial treatment. And a lot of people report back a feeling of hope or possibility where they felt very stuck or frozen, where they felt like there was no moving forward or they couldn't find their way through. Where now there's like this space of possibility. And so it kind of opens up a horizon. It takes them out of the tornado and lets them step aside and be able to see the big picture.
That's so fascinating that it's actually doing physical repair in there and creation in there. That is amazing. And I don't know many medicines like that where you can actually go and feel good because it isn't, it does anesthetize you and make feeling safer. But it's also repairing and healing and growing. That is really fascinating. I don't know that there's anything else like it. I mean, have you heard of anything else like it? Probably not, or you wouldn't be just offering.
Right. Yeah, no, I mean, you know, for the longest time, we thought that like whatever nerves you had by the time you were 2 years old, that was it. And there was no like, you know, making new habits or creating new things or regrowing or repairing from nerve damage. And with this, we know that we can help with neuropathy, and you know, other types of pain that come from damaged nerves because it helps to heal. So
That is
yeah,
so amazing.
it's definitely and there really isn't anything to compare it to. It's very much a breed of its own as far as medication goes. It is 100% a chemical, 100% lab synthesized. So keep that in mind. So it definitely has some very sharp edges and geometric patterns to it. But yeah, it's been pretty impressive to see those shifts in people.
Well, yeah, I want to hear about maybe your own personal shifts, because I come from a meditation background, and the things I've experienced in my ketamine infusions almost feel like accelerated growth that I would have gotten from meditation, because meditation, I know for a fact that in 21 days of meditating regularly, you can create new neural pathways and get into new habits that way and grow your brain matter rather. Ketamine, it feels like a nervous system reset, and it does allow me to get into the state of feeling more rested, like when I meditate a lot, but in an hour. William, have you experienced that?
Yeah, so I think there's something very important about like the first-hand experience that each patient has when they come in, because everybody comes in with their own unique perspective and their own ways of interpreting and the way that they use words in order to describe what's happening to them. And for me, it was just being almost like death by astonishment that here life was existing. I was waking up, doing this thing, and then introduced ketamine. And all of a sudden, it helped me create additional perspective for myself that gave me, I feel like, more depth perception with how to prioritize and create goals in my own life that I feel do a lot better job of helping me have peace of mind and being better able to be sympathetic and kind of look at things in a more community perspective. And I don't feel like I'm alone when I say that, because oftentimes those are the words that a lot of our patients will use when they come out, is that it helps them reorient themselves to their own lives in ways that create more meaning for themselves and the people around them. And you were mentioning the spiritual nature of I don't know that I've ever actually heard your experience with this and kind of how it's helped shape you and your perspective with your life.
Oh, well, thank you. And I love hearing that. That just really resonates on so many levels, because this is kind of a tricky thing to put into words, what you experience in these sessions, because it is so unique to what I feel is your own personal energies that you're bringing into the session, and what does get to be seen and looked at, released, absorbed, whatever. But it was really cool to do these sessions after the past 2 years where I've been growing on my spiritual journey and expanding my perspective in other dimensions. I just interviewed Pete Sanders, the MIT trained scientist who wrote the book You Are Psychic, and validated my experience of learning in different dimensions. And when I go into the ketamine infusions, as the birds are squawking, saying hello, I have picked up some of my past life skills and absorbed them. And I've seen that when I do guide ketamine sessions, where I'm really just listening and observing and providing support. I'm not directing them really in any way, but I've heard past life experience from these folks that are going through it. And so there's
Is that what you, so I had I've never, like, learning in different dimensions, is that like different? Do you mind going into a little bit more detail about that? I was kind of piqued my interest. I was like, wait, what?
Yeah, and I've experienced this in ketamine treatments as well, where Pete Sanders Jr., who is the scientist I just mentioned, he said that string theory, superstring theory, says we exist in at least 10 different dimensions, and that when you open up your higher dimensions by calming the limbic system, because when the limbic system is active, we can't access our perception of those dimensions. But when we calm the limbic system, which ketamine does, we're able to expand more, see more. And that has meant for many people reporting the same things I've been experiencing, that they are accessing information that they then go research and come to find out it's true. I'll give you an example. I was shown a particular symbol, a scarab, and it was a heart scarab, they said in the transmission. And I went and I looked it up, and the heart scarab is something that is in the Smithsonian and has a very deep meaning of being put in the sarcophagi to aid the soul when it's being brought to judgment, to remember who they actually are. And so they won't lie about who they actually are. So it was interesting to learn about something new that I could then research and then absorb into my consciousness. So expansion of consciousness, tapping into that collective wisdom that may exist there, that a lot of people report is there. And this ties back into ketamine, because when we go into the ketamine session, I really experience expanding beyond my physical form. Do you agree?
Like that? Yeah, no, it totally, it does. Like, it's hard not to shake the feeling of, it feels that you're everywhere. Well, I think there's a difference between like a therapeutic dose and a dose that maybe is a little bit too light and a dose that's overdoing it. But when it's dialed in to the very therapeutic dose, you have this sense, these sensations, these epiphanies that feel all encompassing. And then I found for myself, and then 10 minutes later, what was I just thinking there? It felt like it was the end all be all of everything. And now I'm not totally certain what it is that even was going on in my head. But I can remember feeling those ways and thinking those things. And to describe it as other dimensionality, yeah, I could see how that helps create an understanding of what is going on with those moments of consciousness and wherever it is that our thought process goes in those moments.
I love how you said that. I love you two together. It's like you get the science, the spirit, the heart, the compassion, everything. That's why I particularly love what you two have created, and the safe space it is, where everyone feels like family. Everyone gets very gentle, personalized care. And I really encourage anyone who's considering expanding and getting out of these dark moments of our lives, like there is help, there is a tool, and this tool is so easy to access. Like it's not invasive, really. It's comfortable. You're not going to have just a lot of the downsides that maybe some other modalities would have. So I would like
it has so much, like, in addition, it has so much hard science behind it as well, like the peer-reviewed research that's like being done at the University of Utah, Harvard, Stanford, University of Colorado, like everywhere you can imagine. They're all coming up with the same results as far as what's possible with this medication.
Right.
And it's allowing us to like continue to refine that process with hard empirical evidence-based decision making in a really meaningful way, because the success rate for a lot of the chronic conditions that we deal with are like in the 30%. And this, even when it's not done in the most ideal situations, there's still success rates of 70% that has lasting changes. And it's not a take a pill for the rest of your life situation. In the best case scenarios, people are doing a couple of sessions. And we have patients that are leaving and saying, when I heard it described best, that the emotions are no longer accessible to them in the ways that they were. They don't just spontaneously come out of a situation that they're dealing with, that they're able to almost put the brakes on the racing thoughts that they have in a way that even 6-7 months, they're still saying, hey, this experience that happened to me has empowered me in a way that I used to be at an 8. I used to not shower. I was showering 2 or 3 times a week. Now I'm getting up, I'm living my routine. I'm a more productive person in ways that I hadn't have thought possible. And it's just very, it feels like very spontaneous to people.
That's really beautiful. I resonate with that as well. After coming into this world, I've gotten a gym membership, just, you know, been more social, and I've been kind of a hermit for the past couple of years after my divorce. And just, I've seen my life open up as my view of myself, my confidence, and my good feelings have started to return. So thank you so much for what you're doing. I wanted to give you one last opportunity. Each of you, will start with Rita, to maybe give me your thoughts on what this ketamine, I guess, popularity could do for changing our society, for creating a world where depression and suicide isn't normal. Rita, would you like to start?
Right now, ketamine is considered kind of last resort. There's a medication called Spravato or S-ketamine that is on the market now. But in order to qualify for it, you have to be diagnosed with treatment-resistant depression, meaning you've tried at least 2 traditional medications at their max amount for their, max length of time that's considered to, be a therapeutic trial before you even qualify for this. And the reality is, I would like to see our medicine shift that, like, this is the first thing that's done, because in the states that people are in now, the medication doesn't have a lot of chance of working. To utilize medications that boost neurotransmitters or mood stabilizers, or a lot of these medications that people are frustrated with say they didn't do anything, but it got all the nasty side effects. Well, when your nerves can't connect, you can't use those neurotransmitters that are being boosted. So you can't utilize what the medication is intended for. So I would love to see us say, let's use ketamine first. Let's get those neural connecting sites regrown. Let's get those new ones stimulated. And then if you still find that you're dropping off, let's look at what neurotransmitters maybe need to be boosted specifically for you. Because there's several neurotransmitters that play a role in mood. Serotonin obviously is the one that's had the most attention and is always like the first go-to, but that isn't necessarily the go-to for every person. And so getting a better understanding of why they're depressed, why they're experiencing these symptoms, and really if it's a matter of healing from trauma, once you can get the trauma resolved and allow your body to heal, then your body can use its own resources at a natural rate that they're being produced, instead of burning through everything faster than can be produced and then fatiguing, right? So I would love to see a shift in medicine where this is the first thing that we do. If somebody comes into the ER suicidal, let's give them a dose of ketamine and then have them meet with, the psychiatrist or therapist afterwards to like talk about like, hey, what came up? What's going on? How are you feeling right now? And what can we do to support you? As opposed to just a lockdown situation. Let's throw you on a medication that isn't going to start working for 2 to 6 weeks, best case scenario. This is, I think, using ketamine in an ER setting when people come in suicidal will help to drastically reduce the number of patients that we're actually seeing inpatient and or coming out feeling not treated, not heard, not understood as to why that event for them or those thought processes ever showed up. Same with pain. Let's get these people out of pain. It is so effective for nerve type pain and really can help people with the like debilitating depression that comes along with debilitating pain.
Yes.
So if we can get you functional, if we can get you from a constant 7 to a 4, now you can engage in life and start doing the things that you like. You can allow yourself to heal. Then maybe we're not dealing with depression anymore because the depression was coming from unmanaged pain. So let's get,
I've seen loved ones
treat the problem instead of the symptom.
Yes, in their pain and their depression levels, using ketamine to the point where they're not even on painkillers anymore. And that is a big deal when it comes to looking at a society just wrought with these needless deaths from opioid overdose. So I love what you said, Rita. Beautiful. I would even recommend, like, if I could get people from that state of, as a meditation teacher, of being suicidal and they really want to change their lives and their thought patterns, getting them into ketamine sessions first and then teaching them the modalities like yoga and meditation to complement and to really help them with this new life that they're going to naturally want to have now that they are not in such pain and not in that fight or flight, not deep in their trauma.
Really quick. So the consensus, so in line with what you were just saying, the psychiatric consensus guidelines are showing that doing intensive therapy, whatever that is, whether yours is meditation, whether it's working with a life coach, whether it's CBT, whether it's TMS, doing intensive therapy for 6 weeks after doing ketamine treatments is where you can really, really, really utilize both those therapy modes for healing. And so really important to combine them, get that neural stimulation and regrowth and new growth happening, but then working with someone that resonates with your form of psychiatric healing, or physical healing, in order to really solidify these new thoughts and patterns and lifestyle changes that you're wanting to make to facilitate your life in a direction that you're wanting to go. Because ketamine is all about moving forward. It's all about now what? As opposed to why. Why is useful, but now what is what, keeps you moving forward.
Oh, thank you.
That's what our focus is on. And I have to get to a patient, so I appreciate you guys.
Thank you, Rita.
I gotta go. Okay.
We'll wrap up with William. Thanks so much.
Yeah, perfect.
Right. Bye.
That sounds good. I'll slide over here. I got me front and center now.
So what would you like people to know about ketamine's effect on the greater society, or just anything else that you feel we haven't covered yet?
Advice that I always give to people that are coming to either it's our clinic or any way that they're trying to improve their life is try to utilize processes that have been proven effective. And in my opinion, like the scientific method, trying to hold all variables the same and change one thing gives the greatest insight into individuals. And so if this is something that you're planning on considering, try to structure your life that you're going to give it the highest likelihood of success by being as prepared as possible with the right mindset. But then also don't do too many things all at once. Otherwise, and I think this is where Western medicine really gets it wrong, is oftentimes we put people on too many different medications all at the same time, and we lose our ability to identify what's working and what's not working. And while it does work for a lot of people, it doesn't work for everybody. And it can be effective in more ways than just whether they're using like ketamine, but with so many different tools that are out there. And part of figuring out what works is utilizing each one of these tools in as effective a way as possible. And that means really understanding what it's doing each time and giving it enough time that you can see some of these things come to fruition. And that's weeks, months, sometimes years, depending on the tools that's being utilized. So
thank you, because that kind of brings it full circle of, yes, we found this amazing thing. And also, how do we integrate that into a life that is supportive of our emotional, physical, and, soul well-being? Oh my goodness. Thank you so much, William. This was such a pleasure. And again, I'm so grateful to you and Rita for what you've created and how affordably you offer these treatments, and the environment of inclusion, acceptance, and care for anyone who walks in your doors. Thank you so much.
I've always loved your compliments. Thank you. We do try. We are passionate about it.
I only speak the truth.
Yeah, it feels good though. I like it. I like that truth that you speak.
Thank you so much. And for all you watching, if you are in Utah or you can fly here because it's affordable, definitely.
And the snow's great. Dude, the ski resorts are amazing. We got hiking, we got national parks. There's a lot of reasons to come visit. So
I have had personal clients of mine fly in to get some of the shamanic work and the meditation and go take care of themselves with an infusion with you guys. So definitely
brevity
I
thing.
love the website because it shows every condition that applies and all the pricing. You guys are very upfront about that. So I'll go ahead and link the website down below for those who want to experience that. And thank you again so much for the work you're doing and talking to me today, William.
Pleasure. Bye-bye.
And with Jaeger's appearance right there.
Oh, there he is.
Wow.
Hey, puppy.
Thanks so much, and we'll see you guys all later.
Bye.